Yeah, really, I'm yo. Not a grand and a dear yammy. I am power be Benjamin. Yeah, me, there is a funny when it's me and Pana. I come as a demi. I lay in Timado from Bomi Gane. Pisa me Banami one so. Miss me Banami one night. Yeah, me Banami when I didn't see any shiny in a ship every day. Yeah, that's a sign. For Jehovah, Becca Sama Menya Unto. Oh, me are retina. Messi Mama ni Unutina. There is a phone in your Mama Unto. Yami are retina. Meya Mama ni Unutina. There is a phone in your Mama
Dr. Mbacha, what's the main card here?
I'm me towing Kappa DJ. What's the main car?
Well, me towing Kappa.
Good. Okay.
Yo, I don't form a bedroom, dear Nissun and Yamin Shram, and I'm saying, Sass your crown, so when you know my time kuchu, Abasudada. And then Jumedian said, I'm a kind doctor say, and they bed discussing about coronavirus. Zariana, a kunipa bebre, a white punipa bebre, every yasino. And then, a doctor, I will say, a very, very important. And see, was here come once, na ye who say, Bema, any ahodaso, near whom ye bay, said ye bay, ye hunchie, 80 tambo kuchu, make cheerful for another. Now, also prepare a question when some we say, Bia, Doctor, I am ready, or Bema Adiciano, me charm and harbor.
Sassing ye my refugees empty, Metafuma wedding me, my money, white. Nami ya re non trese ma sei Enyamia non trese mi ni pawai Nyami kwane tu mi sisa shebre Minu so betu mi ya sisa mama ni enzo Me ya re nti ya mususu rojo me Mama ni unti ya mususu ntiti me Na ya re safo
Ansana Dr. Bebano made the pictures in nyomani bi eguso mu wahwe bi ansa kwa na ya se dwumadie na se na wa be se coronavirus no enya asem ketwa etise o hwe e Facebook ana ba bi ahwe bia o de koso ana hwe anyom ne koso no be hu pictures ne nyomani bi a e fa coronavirus no ansana Dr. Krabe kasa
obiara wo da e bi mari jeta oh mi are tina esi mama ni unu tina me are safoni nyamo obeba mamenya uto ya mi are tina me mama ni unu tina are safoni nyamo obeba mamenya uto Timado fumbo umigane Pisa mi bana mi wanso Misi mi bana mi one night Yeah mi bana mi weni Yadye inti ene sheni nina shilp every Yeah nasa sana yasa Aye nasa uno Yale sa fwane ke jambo kwa mebwa for Jehovah Beka sama menya unto Messi mama ni unutina Ibamba sirime Yare safoni nyamo Obeba
said me kan say me twa me ho aba na afi yakofa dwumadie na oso wahu said de tie me ya sure say wo hwe no wahu uhu enkronkura affect wo mo Italy so China de na bubruja Iran South Korea and Japan there's a enyasem ketwa so wo hwe sentems ni niwe many age say na nipa bebre abaso in the first place nyamishira mo pa me say yare no ehia yen intimate beto so Facebook no obiaa ye alert so person ohun de echo so wo hwe aboa no kura ne ho the sentems ni ade na je say ehun kura akwa wo hwe say de asi etie na ehun ekunipa bebre ene ukọ ye Walmart ne Costco ne ade na ene nuane ne nsuo ne nyina e short it look like say there's something going on which is serious so it will say you pay attention na nyame adom doctor onye consultation fee onye hwe na otre ade na ema ye ndie binua emfe ni agro frowunia bi se omra na doctor Vera Kuffour Manu are ready ode adesua no ebrey opese yenye yapomudin ni etimi etena seche so etimi ncha ho mekofa doctor na doctor ede adesua no amaye eti doctor binim so otimi nka we were so
DJ what you mean ka
doctor etons kapa etiefo ne ahefo nyina e krado na me di twam se uko Facebook YouTube Twitter baby bia aba fontentan nyina ubenya ye wo so uko modern Ghana tuning ni nyina ye wo ho modern Ghana so yo Hope for Life TV uko adomne UTV nyina wo ho Hope for Life yes ye wo ho ubetima hwe be live opeso akoye website www.hopeforliferadio.com e hoso so obekona doctor daso live e wo ho ubetima hwe ubetimi etie e wo ho eti doctor menche ho meja ama na ade adesua no amaye
that's the great DJ yo obviously I promise that when you have to say and bring one by ya pom dey what me na be ka coronavirus no what meaning said who be brave about
ko be doctor chi obe ho picture na doctor chi no coronavirus no ne enioma wo ho no ene da doctor chi no
okay me that's it into meaning say coronavirus say the who be brave about ko be brave mu na enu nti na enumre no me take that time he said e be ya betumi aka ho asem na ye who said e be si ahwe ye ho na ye nsie nkonya sa coronavirus nti ansa ne be sha asem me mo mpai asafi ho ye da wase so ahwe ye nyina ye so abo ye ho ba bi sa abri ye so say enumre ju be dia ye bi wan kaka ba be boa ama bi bi ewie pay ye da wase what do you say amen amen the coronavirus no kra no they say no cases are e wo wiase nyina the bia wo wiase bia akwa kodru no number of cases are 109,823 nipa 3,804 and every coronavirus almost 60,963 it is so far no no about coronavirus on the cases no you need the coronavirus more China change go beyond if you say SARS free China market be you better say jom bi wo hono ne ho ne start free yes I jom no seafood market dey baby a ye ton ensuo mu emwa e wo nsuo no e ho ne ye ton wo mo e na afei so no emwa nkaka in general enkoko no mo na China dey ye ton mo bebre e wo hono ai ko ye den every wo entinya nkoko but emwa akodo ebi wo kwa bi wo mo echi di a betumi abo ba ko bi se wo mo ton ne ho nam no ayese eye ding mi hunu enya porcupine it's another animal but the one nam ne ding ni na wo ton bi wo wa de ko ye den wo mo enu nti e ho ne saas ye den e free ye coronavirus e wo abo usually ni can free abo mu many people but if san say nipa de every star nam ni nti no ama a transfer every abo anu ma ye den aba nipa mu emo mo tanya coronavirus e bi ene camel someone named camel they are no mo desert mu no so mo hamp mi no any a cattle in general the say na ntie no mo ne all kind of cattle and a okra and a bat so mo coronavirus and so many other animals so your friend say o mo ton wo sa edwom ho nti e ho no mo hu coronavirus e sa se Wuhan China e ho na sa se free na price sa se no wɔn a mpɛ ho asɛm anyɛ dɛ anka na so wɔn katakata so nti ɛhyɛ aseɛ spreading more no na afei no wɔn hyɛ aseɛ so wɔn ka nti doctor bi ɛna kyerɛ so ɔno hui no ɔhyɛ aseɛ yɛ dɛ ɛka kyerɛ nkurɔfoɔ sɛ saa yareɛ wɔ yɛ dɛ aba ɛkum nkurɔfoɔ na Chinese wɔn pɛ sɛ wɔn yɛ dɛ wɔn kata so kɔfɔ mbra afei na ɛhyɛ aseɛ sɛ spread no na wɔn ntumi container nipa ewu no na kyerɛ sɛ wɔsɔ wɔn yɛ dɛ wɔn ka no korɛ unfortunately saa doctor ne yɛ ka ne ho asɛm saa abere no wawu wɔn so wawu free coronavirus sɛ yɛ no korɛ sɛ nyɛ no korɛ sɛ China foɔ naa ne cool no sɛ deɛ ɛbɛyɛ wɔn spread saa message ne too much ne obi anim but wɔn sɛ saa doctor ne saa abere yɛ kasa no wɔyɛ dɛ wawu na coronavirus ne ɛyɛ respiratory illness kyerɛ sɛ ɛyare a affected sɛ yɛ huni mu your lungs mu your upper respiratory system no enti biribi a ɛfiri wo lungs mu a ɛkɔ akɔ wo huni mu wo sinuses mu ni a waso mu ni adeɛ no ɛhɔ ɛna saa virus no yɛ dɛn ɛtumi ɛyɛ dɛn ɛkɔtena usually from animal to person aboa no na ɛnya yɛana nkɛmba nipa mba ɛnam sɛ nipa no akɔwe aboa no nti no sɛsi aba yɛ mu nti saa brain no transmission no anaasɛ air spread from nipa to nipa menim sɛ DJ Mike de map no akyerɛ mo but me one map bi so wɔ ha menim de DJ de kyerɛ mo no a show global cases of coronavirus no na nkura saa brain no anaasɛ yomedase continents a coronavirus na ba hɔnom no Africa menim sɛ Ghana mmerɛ bi na obi ka sɛ oyɛ deɛ wohuro wɔ hɔ no nti coronavirus ntumi nyɛ yɛn ebifoɔ yɛ size yɛ mogya no nti coronavirus ntumi nyɛ yɛn Ghana deɛ nyɛ nhu bi. And I would only say, so the reason why Ghana maybe are reporting a case of coronavirus is that we probably are not having the equipment to report it. They are sure that Ghana for to be a drew who do a room or be a we're checking for temperature from person to person to person. And you crow with some corruption or one intino or be drew a crown or discussion with someone. Ube German apple, I won't say over any day and testing it across. They say crow who or Nigeria or who be with Togo. Or myself who be war, your friend is saying, Sierra Leone, Senegal also so who be war, it and South Africa, Kai who and Algeria, a Srohodom, Kai who said Nigeria, or we neighbors, Togo, or we neighbors. Ain't your brass, I arena quaco drew on no, Kai who's almost so by your chrome wa. Ain't it ye baby piano, a bit drew Ghana, ain't it be I be drew. Or more South Africa, no so when you be the baby a bit travel. Once I drew Africa, and so yes, a bit spread it all over. Eastern Mediterranean also be brave. And Italy, meaning somewhat ya quarantine over millions of people, close to 16 million people. Ever Italy, Sabri. We share the streets of Italy and you ya quarantine, still be and see abontis and ya de emergency and more be a mabonti because Yarena Paco drew and ya sent it to Europe also a boo of Southeast Asia, the and China, Japan, New Korea, Honomni, and a Koso. And a Western Pacific, also so a honey hit is Australia, Honomni, a drew ho, and America has also coronavirus raiding, a drew her. I can't remember how many cases are. They say America has a war, and then Kuffour was our nursing home, no Washington State, as they say, Kosovo, and our state citizens also declare state of emergency because of coronavirus, as they say, I hear. Now, quite bad so coronavirus is spreading. The catcher will say, using him 1 year. Sabre, this answer Nipa Korea Buano, Nipa Korea Sayariano, and yes, spread it from person to person to person. And Luntino, so we are close to be about 6 feet within Obi or coronavirus now. One say away there will benya. If we say a respiratory droplet, and it's a DNA practice, if I want to win here, so when see no droplets there, bano is a year free mubana. So we'll be in the 60s, no go so. Now what do we talk about when I'm now the coca, when I know anywhere near idea. Yari bed, a bit to me aspirate. And also, we are coronavirus also when see now been by 6 feet. Now your friend is saying, oh, when see ya, no question a call who knew a bit to me a day, I call lungs. I'm a walk up on your coronavirus. Usually, coronavirus are very contagious. So, Bronica is contagious. She's a sabra, and then you who are deep by bit me as Freddy, a cobe, bibrino. And it's that time if I call the Yari pano. Sabra and coronavirus, it me spread a day and more. Nelson Sono, I dare who also who say, almost yes, sure, say be a coronavirus, and was surface to say about say be a table. So, Juma, some one way Juma hospital, now nursing home, long-term care facilities, and any healthcare facility, no, also more various services are AB nurses and healthcare professionals, the whole, and I'm more chatting, a whole maybe your friends say computers, this is any idea, surfaces, no, a bit to me, I say a bit to me, but almost yes, sure, how longer, a bit to me, stay, was surface, so, anyhow, a bit to me, I transmitted from that surface no to you. If you are more kind of say yes, very, very careful. Very, very careful. So, but also touch that surface now. To ensure any seminar you have, but they also be used to hand sanitizer. I was about 66% isopropyl alcohol. Now with the idea, I won't say the won't fuck our virus in your day. And when you and answer any day, uncle one, no. And no internet viruses, they say, are spread via community. So, Washington State virus not spread it. Our nursing home be or honoma. Nipa bebre wa nursing home well. Healthcare professionals need to be in the beer. If you know, so yeah, they or more quarantine or more air day. Was our nursing home because we new can't fast. So, coronavirus here, they HB Balfa, so. It is a community spread. No, if you were California, California, governor, no. I declare state of emergency. Ship will be aqua Oakland, California. Now, once again, no, you know what? I'm very surprised. So, my ship now docky was San Francisco because the ship was closer to San Francisco. But it started San Francisco. I broke one doors or where it's one doors. Oakland. Oakland, before the doors of power on and he has also obviously let the ship dock at Oakland because to them, no, a safer. They are unquable for the whole. Never quite it is still, I don't understand why Governor Ainsley AFR. But anyway, Oakland and a ship near airport docking. Said about which we are quarantining for ship because they've been away coronavirus maybe. Into other quarantine, one more 4 military bases. Baku or Georgia, MCMU or Texas, and California and so no. Your friend is saying military base will call for 14 days. Normal observe you more. I check your temperature. I test you more. So making sure so we are clear and sunny a day. Ya more by a day every honor. See, America has say no. America has say no. They are reporting about 512 cases of coronavirus. Most of them are imported cases. What do I mean by imported cases? A young virus no outside of the continental United States. No why they the virus a brain it will could be a musabri and crocodile be free Wuhan, China, and a buyer. It is interesting the time of coronavirus is sharp, Ababa will be echo Facebook, echo Bosti, so she was able to get through without anybody knowing cross or travel up for China. Now she was able to do a friend is saying, make sure that they didn't know. Into a body Tracy Ababa one for testing for coronavirus because she traveled outside of the country or for China. And what to be rare when detected. I went to be one checking the temperature near my new room, but she was posting on Facebook into your operation and trap and making sure that on fire and your damn by. Into imported cases, the doors to mean and call outside of the continental US, no, or when a desire to do an idea, a backward. So her ship was traveling so into ship in the so. And America, how one they travel to, it goes outside of the continental US. If you're home, and uncle for Nayade or what they are backward, Ayade, Abayin. And to say, no coronavirus, the United States, 512 cases, and he find a war. Washington State, 122 cases of coronavirus. Nipa 18 so far now and counting. It probably could be more than 18 since I went online to get an update because they call online to get an update and I was watching CNN a few minutes ago. Omo governors, your friend is saying health department in Pennyphone Kasa, but so far the 18 cases, 18 deaths, and they are confirming. But it may change maybe in the next minute. We don't know. So don't tie me to those numbers because anything can happen. New York, 106 cases confirmed. So far, but once again, I don't know. It may probably change in the next hour or two. New York, they say the was a subway train station, all with turnstiles that will go through to get onto the to get through. So they be able to be a platform. Or my high in they say no, Clorox wipes. Every pakani many now who baby a tickets no, they are wiping all those places. Are you cleaning up? Said the bear will be found in Sankoka, Lord in Sakwa spread it disease bia mobia. California 104 cases so far. Massachusetts 28 will be a war. Texas 22 will be a year. Nebraska 14 will be a year. Oregon 13 will be a year. Florida 12 Nifem Colorado 8 will be a year. Illinois 7 will be a year. Georgia 7 will be a year. New Jersey 6 will be a year. Arizona 5 will be a year. New Hampshire 4 Obienye Pennsylvania 4 Obienye Rhode Island 3 Obienye Tennessee 3 Obienye Maryland 3 Obienye Nevada 3 Obienye Utah 2 Obienye North Carolina 2 Obienye Indiana 2 Obienye South Carolina 2 Obienye Virginia 2 Obienye Wisconsin, Minnesota, Kentucky, Oklahoma, Hawaii, Kansas Nipa 1 yawo honom but obi enye nwuye. District of Columbia, Washington DC nipa ba obi enwuye. Missouri 1 obi enye nwuye. Vermont 1 obi enye nwuye. Connecticut 1 obi enye nwuye. Inti kwaiba ni efa so kwa ye tested for coronavirus. Omo tested by doing the upper respiratory swab. Inti no mo be e wipe wo swab ha say no. Na chesi de ahye you walk back to your friend saying CDC am o ma check it. And after you betumi am wa coffee agu container mu ne dey and don't see a check it. Na sa testing kits no. Na say na nko munya shortage, but I think so more working on intensive said you be more. No betumi aye dey I distribute it. And they are various places no betumi aye more testing of the coronavirus. In the symptoms of coronavirus or cry aye dey who say borini bibi obi say what are the symptoms? Symptoms any be the day. Any the wo bowa. So and after wo humi a won to me humi ye day ain't so. Now wunye fever. A fever is when you have about 100.4 degrees Fahrenheit and now 38 degrees Celsius. That is what is called a fever. Now says wunya pain ewa wo koko ha say. Na pain no e ya dia e koso na nye day enjai. If you also abedru baby no you're confused because our temperature koso which me are confused into which me are confused. Now says we lips no akwa blue and ebi ho anu anim aye day aye blue. A quite person you which me are preventing coronavirus. Ebi any say we avoid this one so be area. Do avoid close contact with any patrono. So if it just so happens that if I want to see no area now to be avoiding close contact na. But what they also be protected with share mask. So when we making sure so with surfaces with kitchen no kitchen counters no with the Clorox wipes need be then every paho nyina wo bathroom wo be paper no mo e puno e wo fie door knobs e wo fie nyina no for Clorox wipes be paper no mo nyina especially more franket one kai hu sa akwala de o de saka bibia na ekoye de ekọ nanum iti check wo man so making sure so wo man so wo hro mo nsa at all times clean wo mo said be ya o mo transfer be free from any day enko wanum ti mesra mo door knobs mo windows so kra mo so windows mo say bia no so window mo abue. So if you're going to constantly keep on opening and closing your windows but what the answer with the Clorox wipes you paper wo puma no nyina baby a wo touch bebrebe no mesra mo a mo fa Clorox wipes and paper especially our bathrooms your toilet na your tena so no just constantly wipe it. Assume that there's coronavirus in your home. Just assume. It be new, but just assume it. And constantly clean. Because I'm quite me are preventing. I think so carbon thing. Now a carbon thing, no body. Then you're not happy. I bet don't say better when we don't say better one. We don't say better when any other parts now and what's through have say in the air corner. But what is the one who on Sam so don't be touching your entire part, the parts of your body up here. Because the bit we are cause a problem. Momo what they have Clorox wipes no. Momo carbon thing as a ziplock, obviously be a shemu. And now say hand sanitizer, don't you be getting ever show bag mo. Now could drop on tia, near be a baby near over to the hand sanitizer and be a day at a pack. Say be a fan so what's not training mo. I could yana what's not when you're comfortable. You have every right to clean the chair, the seat before you sit on. So, if just so happens a chin there, so it's not playing what. You have every right to wipe the plain seat before you travel. May I travel a lot? And see, make me wear gloves. And they a Clorox wipes. Ni real play no one. May I send a message? No matter what you answer a message. Ni ba ko ti me nche ni say be ha no. I could care less. I'm just trying to protect myself. In the idea here, pa. So we are also so I'm Mr. to the fear. Yay, I'm going for you free baby, a baby, no. Yeah, yeah. Empathy, if I see a question because the idea is so young, question you be. This is the time of one question will be any who be you with you. Say if I call you a dear, hotel lawyer, let's find a court. No soon. If we say you are sick and the government has said, say if you're sick, do not go to work. Let's say change almost a break, you are not supposed to go to work if you're sick because no being swap when coronavirus. A regular cold be the wire than when ya. Uko will be a coronavirus. I bring the papa sneeze the so. Now one walk up on your virus now. And one who wish you up so when you're sick, please stay home. I say you so no. So wo when see and I say be but what they also be used to tissue. Now when they are one no. Now I bought wire there good. When see for tissue. If I show it, no when see we are not watching it. Let the hand sanitizer out the be your own hand sanitizer new one, but what they are not over one it was sink for 20 seconds. Better than what we saw roll some with warm water and so for 20 seconds. What a happy birthday, Manisia. That exactly is 20 seconds. What a happy birthday, Manisia. That's 20 seconds. Into to happy birthday while you're washing your hands. Said I'll be that full 20 seconds of washing your hands. Oh, rules, that's why yes, oh, rules, aqua. Well, more renewable, but what the answer we him, our who you know, come. Now we are the paper towel, the paper. Watching that. The bathroom, public bathroom, no, away baby, a puno honorable diabo. What the answer of better paper towel, nippy. Now we dear pushy door, no, to get outside. So there be all rules there, one side and 5 germs to be on your day, and question one start. I say so. I dare to swat here, pa, any face mask, na. They say, no, brave, sorry, or what's a face mask? So we a healthy person. Now, when you're face mask, no CDC, recommend this, and who is here, so you're doing. We best our face mask, no. Only if you're sick. If you ever when you're cold, and when you're flu, and after BB Sadia, of course, wear the face mask. If you are now what cancer, immune system, no, are very low, dear. Yes, a face mask is okay. But we a healthy person, and we here so set our face mask, no, a day, thing. I believe some about washing your hands, which is really, really important. Monkai who's a brain, no coronavirus, you need who drew, you need who vaccine. Or who's a flu, no dear, you will write it with your flu vaccine. Coronavirus, there is no medication. And there's no vaccine for it. It is a say, no, sir, but the winner, don't pay us over testing normal when you're more bonny for supportive care. If any day, you remember IV fluids, any idea, you be keep people comfortable, wound to me, home, you be to about oxygen, so through a nasal cannula, and answer rebreather mask. I'm away to me a day, any idea. There's really no way, a drobia, how you bet me the amount. And the also bet to me and it's a very severe and so swap or bet to making sure that almost support to vital organ functions, making sure that your lung, you may there's a ventilator near this too, so then they're going to do that. Making sure that our heart will liver, and all the other organs in the body, they are working very, very well. In the honest animal bet me in home at higher risk for coronavirus. Any or more when you nipa a nursing home no or at higher risk. Because I was a nursing home, no, only are confined in one place. So we could do we now for Tinaho 18 and Nipa at a very close together. It is uncle for only at higher risk. It's more we Juma our long-term care facilities. And now so we Juma group home near the end of protect the home. Hand washing is really important. Cleaning surfaces is important. So we Juma in any of these facilities are. But what any hospitals near the end, but what they also do here. We uniform out the Juma no. And some for uniform no treasure will see what them. If you have a garage, garage, I know some saying something very serious, and it's serious. That's a plastic bag for good garage on put it in, tie it up, and then go straight to the bathroom and take a shower before you even do anything. Men call kitchen and or bar. Make sure that you are not touching your child. And if the hand sanitizer and be on sun no and sun out on sun to be but go straight to the bathroom, take a shower before you even start to do anything. Meaning, so be maybe your point, you will buy out my bread. No, I don't watch on impact. This is not the time to do that, Mr. O. This is not the time at all. making sure that you're taking precautions because with precautions it can save you and can also save your family as well. Because if you're building on higher risk, or more heart disease, or more diabetes, and more lung problems. So we a lot of lung issues. So on to the COPD, asthma, any idea the sound of winning in an and but will be a coronavirus no you're close to the person that or when senior agenda droplets the more and share any pakona days apa coronavirus. Meaning some of the questions
but 1 second. But you want more from mommy few minutes. Why? Okay.
Meaning say obi be busa question say okay now Chinese restaurant any idea no I would just say you make that decision. So if you so Chinese restaurant never boa and you know also. So if you say brain is so you pass over Chinese restaurant that's all protected with one then protect yourself because once again no you don't know aduane a wukudi wonim nam cry a woman. I'm not discriminating against the Asians. This is not the time to do that. Yes, I will singling them out. But I'm just saying that you need to protect yourself as a person. Said you be a woman, you are no koyo. Now one spreading come out with bushing for them for how any money they emerald. Since I be DJ Manu himself for questions to pray.
Yo, doctor, you better was pa ne say wakasa pa ene your line is so hot. I'm saying Jumedina and Doctor Egusun. Na quick one son, I'm a cosocra of Rafa Generation, Udini baby, I can free. Of Rafa Jama, whom I see Udini baby, I can free. Okay, I'm saying, Unyan, ready, D. Oh, you're ready, you best Edu Waba. Doctor, you better say, I'm say Jumedina and Odia Mayeno. But I'm tamu kuchu, mammy. Questions no more modem for Facebook, maybe sending in a. I move for in amro. Mama 1 second. Na me my doctor pay brace you be nom. Na afi o me answer your questions na MIA.
Samiario don't fuei. Memo ya ri kumio. Samiario ya risafo. Samiario adumakuma. Samiario me okanchurama. Ya risafo ba kupeneria siwo. Samiario don't fuei. Memo ya ri kumio. Samiario ya risafo.
Ye radina dia semni. Say yare na nya sadie beye hu. But some more questions and the be the say book no. Mo wan nyenti na nya sa. Me read ya doctor a better sana. Wake kani nyina wie. Etibu amane nya short man matimi de. Doctor you waste time since nipa bebre wo so na questions no so more no. Me call no straight. Doctor Obidio I say this virus can't stay the temperature of 35 to 40 degrees. Doctor, is it true?
Why the can't ask me for medical school?
I don't know.
And that's lab. Okay. You know what? Don't be saying that. I know that Obi can't free Ghana because your temperature is very high because we live in a warm climate. I want people to stop saying that because I'm in Nigeria, coronavirus is true. South Africa, coronavirus is true. All these are warm climates, right? So how are you going to say that? When you're very careful in terms of what we're saying, because whatever you say, you need to have facts to back you up. If you don't have any facts, any evidence to back up what you're saying, please. And what can be no more we say somehow can hear correct. And then you don't take any precautions. Then if I follow for Yaria, so please, let us just protect ourselves and prevent the disease. Prevent Yay from getting the disease. That's the bottom line.
Wow, doctor, may I ask a quick. Doctor, where's the also please, doctor? I have seen that Dettol is good for that coronavirus. Is that true?
Well, Dettol you're disinfecting. And so would ensure one who means so the iron actually you see. If you don't see a disinfectant, some okay, you want also need to Dettol. If you don't see a disinfectant, if you ensure couple. But the best way to get rid of a lot of germs, and it's your friend is saying, Clorox wipes no one, but they say no meaning that Sanya man and why and for propaganda, but will be a
actually, we're going to do.
Oh, you know, So we need to be any just on the you can crack up. What Clorox the crowd between the Clorox and do back. Now we show us a Clorox into what your friend is saying Clorox, liquid Clorox. Upa there quarter of a cup. Now the show 1 full cup. Now I said glove. Now we did paper towel for which with your white to which we just be a from the child floor. So how do you do that's a different story. But what child floor?
Wow. Doctor Eda Sipa. Doctor, where should you say I take my patient to the physical therapy twice a week. The fact is that the fact are the no. The fact is that home I use strictly universal protection, but I am worried by the patient being touched so much by the therapist. What do I do? Man, so I have a question. No question.
Yes, of course, in the patient for physical therapy, physical therapy is a patient because of course physical therapy. All dream a patient needs was so any therapy. All dream a coronavirus they've got to touch them. If you get mechanic say. Since all physical therapy is touch patients, so once again, hand washing is very important. If you want to, and son, I'll bet to get fast patient in a cookie. For what they are now, want to call and son and work free. Physical therapy office on them, and son and baby, when you time one, patient the baby, Kobashi, the whole so a whole say anything, hand sanitize and it was a beer and son wash your patient because at that point in time, you are protecting yourself because you are clean at that point in time. It to be here for your about one. It's time to what the Clorox, hand sanitizer and found and you are actually preventing disease. I hope they makes sense.
Yes, ma'am. Mommy Vera, I'll say, okay, thanks very much for Mama for such a great presentation. God bless you. And I'm so glad that doctors not joining more. Dr. Greaves, thank you so much for joining the program. Dr. Vera is doing all the jobs for you guys. So we need all your backups. Okay. Dr. Sanaba Sumo, Yamisram say, when you're Mama present, Dr. Nay, to move your consultation fee, and moving in Emra Hano. Namanya General Bala and I know the family. So, okay, Doctor. Doctor, where should you say? Hey, what is CARS CV2, Doctor, with the technical terms? What is it?
SARS-CoV-2. It's just the virus that causes coronavirus. I hope that, it is. Okay, so abbreviate coronavirus COVID-19. It just means coronavirus 2019. That's what it means. But say SARS, no, it's just coronavirus. It's like it's the virus that causes coronavirus. I hope it makes sense. Yeah.
Oh, okay.
Influenza, it's just the virus that causes coronavirus.
Oh, okay. Doctor, the next one I was saying, Doctor, I really needed to repeat this. Where do coronavirus come from?
Into the cattle say it comes from animals. They mention the camel. They mention the bat. Someone in bat meaning TD. They mention the bat.
My friend Alpine.
Oh, okay. And a cat.
It be so friend and I'm considering.
Okay. They are no free. Camel, they cattle. They cattle. Someone in go. And then cheer horses. And a cat. Cat, your friend is saying.
Okay.
Okra if we okra so and one bi wo ho no mo a omo twi di ni nim wo se be na metire mo aboa bi a aboa no ho dindin ne honam na yese enye tortoise honam ayese crocodile honam bi sa or tail aboa no ho hu ni nyina no omo ton bi wo dwom wo China. Yeah, as aboa no say these are the animals that or more, yeah. Now one may send to a free
Dear Doctor, medicine. Where should you say, Doctor, is this virus compatible to SARS or to the seasonal flu?
No, it's different. This is a totally different virus. It's a totally different virus. Okay. A totally different virus. What is, although you have the fever, the cough, the sneezing, the temperature with it, so a different type of virus. Into your no so a different thing, influenza virus. Of course, both of them can cause death. And actually, the influenza virus is much more deadlier than the coronavirus. But the only reason why avian influenza if anything, death, I mean, still, it's high rates of influenza as well out there. But Chinese influenza, and it's not a vaccine, and no water killed. Coronavirus, we need vaccine, we need it. So that's the big difference between them. We will be we will see. And we also know nobody knew it was coming. So they are prepared for a vaccine or a medication. Also, influenza virus including the effect and it's there, right? Every year people are working to find different vaccines, and different medications. We say we didn't know it was coming at this point in time. Although it's happened before, no. So nobody has prepared to make a vaccine or a drug to fight them. It's two different viruses. I hope that makes sense.
Yeah, Doctor, it makes sense. But Doctor Nyamisha, say what answer at the any Doctor, where did you say a lot of people from the tropical areas are boasting that they cannot their skin, their body types are not cannot be affected by the coronavirus. How true is that?
Let them continue to boast. Let them continue to boast. Because what they need to understand is that whatever happens in China goes to the entire world. Yeah, Chinese for what Chinese for Asasi so aye kase. Chinese for one more Africa pa say we have to Krobia. America so the Chinese for wa. But they say no, meaning to make us a nipakono tie ya. Coronavirus you be Nigeria, you be Togo, you be South Africa, you be Algeria. The last time I checked, all these countries are in Africa. Unless I'm mistaken, our countries, so many Africa. The last time I checked, they're all in Africa. And interestingly, Nigeria is our neighbor on the map. And Nigeria, of course, Ghana, for Nigeria. Togo, so the same way. South Africa, so Ghana, for so you can't tell me, say, it can't survive there. It is there now. That's just a reality check.
Wow, Doctor, and that's it. Doctor, where should you say are some people more at risk than others?
Yes, me catch them with them. Crawford will hold me a higher risk. To say, almost nursing homes, older population. Seattle, Washington State, and who coronavirus, attack it, nipa bebre, nursing home, and the almost nursing home, at higher risk because our baby back. So we're all congregated in one place. And you're free to move at all times. Obu nursing home was a wheelchair, we just will be the piano day. And then the car day. Into that enclosed space is causing a lot of problems. Obi the area no ko. Aba say nipa bebre de wu ho a. Obo try some be quarantine to phone being to for why they every free one more. And of course, obo be higher risk and penny for who are diabetes. ABL or more diabetes, so what respiratory illnesses, asthma, and COPD, so we are at higher risk also of getting the coronavirus as well. It doesn't mean you get it, but you are higher risk.
Yeah, Doctor. Doctor, me that's a hand. Kuffour boy, Paminia Adumba Raymond, one name, Mammy Grace Ochi. Was it a Abwana Bundin, your friend Apra, Anna, another one, or is it your friend, name a type of reptile you're talking about? It's called Aprawa. In the tree.
Okay. That's okay.
Yamisha Mopa, hey, you're gonna do one for 3 days now, remember it now. I know a day. Yeah. Okay. Mama, where is it? You say are children also at risk of this infection?
Yes. And let me say this: everybody is at risk of getting coronavirus.
Mama, but for us, we about pregnant women.
Okay, almost we are at high risk. Everyone is at risk of getting coronavirus. The fact that we need coronavirus because once again, a respiratory illness. It is will be no when so. That's what happens that droplet need be getting and now when they come when see and when you do transfer virus. So I want you to understand that everybody is at risk for getting the virus. Yes, you will be no higher risk. Anyone with diabetes, and heart disease, and respiratory illness, pregnant women have a higher risk, and also have a higher risk. I think that I was or the second or the economy. And some of them are not day will be when see. So one in the agro, who had an said twice or more the agro near so
Wow, ma, Nyamisha pa, Minia Emmanuel Draw. I see great work there. Okay, I love so much. Ma, it's Kuffour Niaji program no and the pa and the line so I see more. Moving in my doctor, we are ready. And no bear sending in a sacrani jano. Doctor Madison Fanche, and they bet your mum pa. Yo, doctor, I finally the moon number time could you a corona and I. Oxy, is there a treatment for this disease? My only treatment or
you need treatment to be you need treatment. The other be a friend of supportive treatment. Supportive treatment means that when you have coronavirus, when they are severe, you do up for hospital, you bet you be IV fluid. So that prevent any dehydration. Now your friend is a wound to be home, so you have a nasal cannula. And after we breathe, I bet to be up oxygen, I'll be near the apple there. They are trying to be preserved with organs, the whole body, the lungs, and the heart and any other body organs. And you need a wardrobe, this is just a supportive care. You bet me the amount, a brow before hospital. But the wardrobe party be a vaccine, and I wear dry, you bet antiviral, bet me the amount. And for course, I bring the pharmaceutical companies to be brave. And the university research labs be brave. Research intensive after home, draw after home vaccine. So that's what people are doing. But who drew, yes.
Yo, wait, I say, yes, why is Openu Kredu? This is the time we need him. He should bring the tree encyclopedia. Which I look at you, man, Yawada, or whatever. Maybe you'll be mentioned in number. Mama, what's it near Michael? Or say, can acid cure this virus?
No. The Pamacho acid is the acid, they are very potent. Walk off of acid about see a bit too fraction. So I say, acid is really show one. Timmy in say the chrome there in some very wire. Acid is the Yaman say intimate throw, but what is all for acid and can't get all one back. Coffee the best you're not allowed to be good and number of fast number. So we stay away. And near more says a bit to me up what. Clorox wipes and the car wants them, hand sanitizer, and it's a whole room that and only precautions that we need.
Wow. Dr. Nyamisha, Doctor, when you say, when should I be tested for the coronavirus?
Okay.
Yes,
yes, I want to be sorry for coronavirus. You need to be asked to walk into a doctor's office and say, test me for coronavirus. That's not what the case is. If you are not sick, you don't have any symptoms, then what's the point? The only time I'll be call doctor who I can't say be a and it's a watch with temperature 100.4 degrees Fahrenheit. Who bow be brave, who when see so who cook ya won't me home and no from doctor office, they catch a warm. And to tell your doctor's office ahead of time, say, these are the symptoms I'm having. And sakra no alcohol. And to brown won't when see me at the end, who cost what a mask. Because one person who could sneeze who so who almost now fire at that point in time, you need to coronavirus. But at least who call a doctor and the officer, unless the doctor and the person will take precautions, then they can send testing at that point in time. But won't be sorry to see and call a doctor also want testing for coronavirus. Debbie. That's not something that's being done.
Wow, Dr. Nyamisha. Doctor, where should you say how can I avoid getting the infection since I work within the high populated dense area?
Well, hand washing. Once again, hand washing. So and I follow the protocol and the policies of baby away. Hospital Biano has come up with different protocols as I bring and I say different policies. Our more can't show my employees what to do to protect yourself. It's who you remember the say Well, body also be follow. So, okay, you may catch your session down. Let's say gloves, let's say master. Follow the way you may day air catch on and cattle. Maybe I may say master mean to be home. So, where you may say, but what the other said to protect yourself. So, where you may say, Shagawa, said to protect yourself. So, where you may say, gloves, make sure you're doing it. Now, over one as much as possible, make catch them on them. Who free patient back, who co patient back for them one. Who for one son to walk for the next patient room. Mr. Namwa, don't just take your gloves off and assume that the fact that you had gloves on, you protected your hands. Yes, you protected your hands, but you never know. Into the moment you remove the gloves, wash your hands and after use a hand sanitizer before you move into the next patient room. I think it's equipment doctor will use to attack with patients. Thermometer and the home corner, but making sure that you are wiping all those things down. The good news about Chroma say, yeah, what the nearby difficult nearby who hospital be breathe. We show gloves away you be. While wipe the thermometer, blood pressure, no say, and yet can't so who's a ya now who may be fair home. Who prepare no who you know, blood machine now would deal for repair for who make sure say it clean. As soon we say in front of mommy and now for in that hospital, I will send on. Who so protective warm, but so protective home. So make sure the equipment you're using also you clean. So the BB will cry and transfer and cool before. So follow the protocol of your institution. Extremely important.
Wow. Mommy Frema, oh ma, God bless you. Mommy Grace.
Amen.
Mommy Grace is Yatamu Kuchu. Some Ghanaians are polluting the atmosphere by telling people to use garlic. Mama, true.
When you're garlic, the only garlic now after the
I don't know.
Okay, garlic has antibiotic but they don't interest. Keep in mind, this is a virus. It may name the ancient question for what's one garlic. No garlic na nepa, not no garlic na iodine. I don't know. Idea. You bet me a catch idea about a say 100. So what I say. It be a short to work garlic no. Obi wo ha garlic wo gusu and opa wiani anaje. Wan fe kura garlic no. Wonu mu nsuo kura obeyi twa garlic agum. Me de be ka kire mo say, de doctor for kano, the healthcare providers say kano, and no na monye de muntie, the CDC eka, any report a whole way cost a free expert a honorable. And yes, will be a 4x1 be any public now be candy, no be idea. Listen to the expert. If a chrono only expertise, okay, be a cocoa busa obia unim. Yeah, Ghana, for we tend to do that. Yeah, Africa, for we tend to do that. Obia won't masem. Immigration. Also, be quite me say. Immigration officer. And in Kobusa, expert, na attorney na unim timestramo where your health issue. Mumbusa healthcare professionals. Mamu Kobusa will be a winning. Garlic de nim you say one more thing.
Wow, doctor, that's a garlic de see the tree again. Mr. FK Benson, Yamisha also joining. Doctor, where's it say? I'm in the health department, but what should I do if I had close contact with someone who has coronavirus? If
you feel that you've been exposed to the virus, make sure that you're reporting it to a healthcare professional right away, into a doctor. From a doctor's office, and say, we feel so why you're exposed to the coronavirus, and you would like to come in to get tested. So what I say, and you right away your appointment to call doctor's office if you feel that you've been exposed to it.
Wow, doctor, what's the I mean, so what's it? Where the wow, how you when I catch on into what be one who do obey. Doctor, I say, are face masks effective in protecting against coronaviruses?
You know, the CDC does not recommend it. Say we are healthier. Say we are and we here say with the mask in the day because it doesn't do anything for you. The only time I will recommend it with the mask in the day, and if you are sick. In fact, when you're cold or the flu or any kind of respiratory problem, yes, right. Of course, not say. But so when you're here, you know what, it's not necessary. The only time they may recommend such a mask and they say be a we you know what be so with high-risk populations, to say, make us nursing home, long-term care facilities, group homes, exposed and they may say someone share mask. Someone who will TV or more course our long-term care facilities, nursing home, the Washington State, no, who's a normal gown and normal mask.
Max.
And the gloves and the idea na no mu for the now also as a normal the sheet to crown so as to say no makata and son or move feeling for into one day you're required that they have to protect themselves. It's the American when they say if you work in the healthcare field or what they are follow protocol now and what organization be our protocol. Follow the organization's protocol. But so when you're here and we have to say mask now the corner number one thing. It doesn't really do anything for you. And actually, you make people even be afraid of you.
Yes.
Because then they think that you're sick.
Yeah, doctor, that's it. Doctor, question you have for me, you know, boom. I mean, about Joyce Wilson, Oba Adepa. Okay. But Joyce, you know, say, what can I do to avoid this crisis? Oba Adepa say, some people are also saying we should drink alcohol. Is it true? Is it true, doctor?
All right. So the first person, you cannot do anything to avoid this crisis. It's a problem. The problem is there. You cannot avoid the problem unless over quarantine who will see no why is the you. But that's impossible because we're doing better. I'm walking grocery store, right?
Yes.
So there's nothing you can do to avoid this crisis. It's there. You have to take precautions. Precautions even my country. We call grocery store crack carts now and what now we could do grocery. Who say I know more wives to home. You wives live in a carts and stand why they what's so one side walk to near my way day. So you can take precautions. You can try to prevent it. But the crisis is there. You cannot avoid the crisis. In the end, there's nothing you can do. Protection, prevention is all you can do. You talk to me, you know, because you see woman alcohol. Maintain system no. Nimbe be a free buy it. I cannot speak to that. But the mechanical one is say prevention, hand washing, you wiping surfaces, making sure so we are all business making sure that you're protecting yourself and your family. That's all I can say. Alcohol no dey me say. Hello, DJ. Hello, DJ.
Dr. Atimenka.
I'm
saying me timid. Me say Ghana for menti asio. I say I don't know. So obi to baby I say alcohol, tramol, any sanyo no. I read to me a coronavirus.
I don't know.
Mama, obi said the idea about okay, obi answer. I say this is a highly contagious pathogens. How could garlic heal it?
Thank you.
Ghanaians.
Thank you.
Thank you. Just talk. Yeah. Ghana for ye kasa more.
Yeah, more.
Maybe you'll be a medical certificate in an order.
Yeah, you use society no they find a cure for disease and can you call your name be brave.
Yeah. Mama, where's so I say, is there is there a vaccine against this virus? How long will it take to develop the vaccine?
To develop anything takes a long time. To develop a drug takes a very long time. To develop a vaccine takes a long time. As a matter of fact, a lot of medications are some of them market, they idea about 10 to 15 years. Because near Drobia, you develop it to be Drew market. After testing it, the FDA can throw it out. It's a vaccine, so they may take a long time. It's not going to be within the next month or two, and not being a whole vaccine because it has to go through a testing process. So you have to try it on human beings to see if it works. And so there are clinical trials that people have to go through. Then the FDA needs to approve this particular vaccine and send out the market. So we are talking about years to a month. ABA they'll speed up the process. The FDA may speed up the process. Say, okay, we want to review this quickly because problem we have. But even that, it's not going to be within the next month or two. It's still going to take at least a year or two to move forward, to push it forward. Until we still have there's this time. There's a lot of time we need to wait for these vaccines.
Your doctor, with us, doctor, questions in there, Monty. May I sure say no, I prepare.
My prepare. Now you said some questions.
Okay, doctor, we say, am I protected against coronavirus if I have the influenza vaccine?
No. I don't even want to go there. So influenza vaccine was made for influenza virus, right? It was not made for the coronavirus. Every virus is different. It has its own way of working. It's when the can say, I got the flu vaccine, so I'm protected against the HIV, right? And also a virus, right? But you're not protected against HIV. So you're not protected against it. You got the flu vaccine just for the flu, not for the coronavirus. They're two different viruses. I hope so we understand that. The flu is not the same as the coronavirus. Although we now with the same similar symptoms, no, and ya the crow. Think ya the crow, yeah, and can buy and one and can the flu vaccine, no, keep it with the amayin, keep it with the antiviral, so we use for flu, no, and so bet me amayin. And so they are not giving us that. They are telling us there's no treatment. Therefore, no, getting that flu vaccine does not protect you against the coronavirus.
Wow, Doctor Edasi. I say, Doctor, what is your take on this? How long will this outbreak last? Should schools and daycare centers be closed?
Well, say, we don't know how long this outbreak is going to last because if you've seen the numbers, hundreds of thousands of people have been affected. Over 3,800 people have died from this particular virus, right? So we don't know how long this is going to last. Countries are quarantining people. As a matter of fact, Italy and about quarantine over almost close to 16 million people in the country of Italy. So because they say almost true, the air cost almost say almost sorry promise there will be no more baptisms in churches. Which will come movie theater. Daycare schools and the idea because it's a state of emergency right now in the country of Italy. They want to take precautions. America, no, I don't know what's going to happen, right? It's really up to number 45 and his administration and what they want to do. And it's up to the governors in the state. State of California is declaring a state of emergency. New York also declared state of emergency. So it really depends on the governors in the state. And they, your friend is saying, public government officials and what they're going to do. So we feel say, if you're who say school be coronavirus number, where cause the problem, they may shut the schools down, but we don't know. It's really up to them and the decision they make and how dangerous they feel that it is. And some of them make a decision. So I can't really say that they should shut schools down. We are not at that point, and we will know when we get to that point.
Wow, Doctor, work as a I get to Orleans, but I see, do something before you die. So, Mr. Number 45, do something before you die. Hey, okay, William Michael again. Or say, what about the fruit acid I'm taking about orange? Well, say, acid nana will be busano. Honestly, busase. What about the fruit acid? I think he's talking about citric acid. So orange, I know.
But I know the offer. I know it's just all preventing coronavirus. It's you eating a fruit just to get your the vitamins that you need. Ain't you know? It's a vitamin that you're getting. Ain't you know? It's not preventing coronavirus. It's just a vitamin that you're getting from your fruit. Ain't you know? It doesn't do anything. It doesn't prevent coronavirus. I want to make this clear. It's not going to prevent coronavirus. You're building up your immune system if you're eating well. If you're eating your fruits, if you're eating your vegetables, you're building up your immune system, which is good. Okay? But to prevent coronavirus, no, it's hand washing. Taking the necessary precautions. Washing your hands. When you sneeze, making sure that you're using the tissue, you're throwing the tissue away. Making sure so we are healthcare environment, following the protocol of the organization. So organization is a mask you want to do it. There's so shed gloves that you want to do it. There's so use hand sanitizer, you want to do it. You want to do prevention. The foods that you eat, you are just getting the necessary nutrients, the necessary vitamins, and the idea that it's not preventing a disease. I hope it makes sense.
Wow, ma, it makes sense,
yeah.
Doctor, when should you? I'm saying, baby, I kind of want you happy about that. It's just a explain, man. Or say, okay, two questions. My first one answer, and also, well, I'll say about the heart disease and a diabetes, and a more stroke. No, it look like say the wood say mono. My question here, I'm saying the real wood say mono. It look like
we are at higher risk.
We
are at higher risk.
Yeah, it's I don't know. We have a question. Say the any baba or that kind of disease or no, so on stay indoors cry and answer saying.
You can't also stay indoors. You can't say you're higher risk. It doesn't mean that you have the disease. It means a greater chance of getting the disease. And once again, taking precautions. Once again, washing your hands. Once again, using hand sanitizer if you need to. Once again, wiping down things. Once again, grocery store I use almost sanitizers now where I paper packet and one son what's so prevention, protecting. And if an old to be cooking itself ever demo, they have to get out once in a while. Every crown or doctor's appointment was where they walk. What to be castle or shed them. So and the fact that if I was I are really United to see a bunch no way coronavirus and just our cry. If I have to also move around. It is so prevention, any idea is here. So the baby are going to be protecting them.
Doctor, Doctor, where's the so dear? It's about the clothes. Where okay, I broach it. Mechanism. Or but say I broach it. Okay, you bet me. I change your home anytime I record you, baby. But so, for instance, say Ghana fitter for what I did now or the quad you man on bar. No, my side, no alcohol. It's almost what kind of advice. And I remember moment magazine, Debiano.
I put you, I made the money for one say, Uko fear definitely, if you're not walk on it, Uwe guy, Neboa. Uwe guy, Upa Udru, no. No, I say guy, Wapaku Jarin 10 times so, and son walk over them. No one wrong who way guy, who said they be a home fat out and tidy and call them, and Kugu them. So that's the recommendation I'll make. Ubi our guy, why because we need a guy and not in Mara. If you're Ghana, say, yes, you say, dear, one way guy. Bathroom yet, yeah, I'm not sure. But for what I know, Lydia, baby, no, I see our rent a crano, baby, or how we did Ujari. So when the baby so sad, yeah, Ujari, yeah, and you make catch or say, ABI, just send you see how
I'm so I a question here, what I said fitter for so on Ghana for fitter for said or more fino.
Oh, that was somewhere.
That's right. One time, you know, what we see now, watch you.
Oh, quite, I won't run who won't get a preco.
What can't I do?
What say?
Or can't I do? Almost sitting now watching now watching.
And if they say a woman sitting now watching, or we see the Debbie.
Who be the artist said the other people and one for tables.
I mean, sir, yeah, I mean, Mara, size a pentacle.
That's right.
It's a Castle, so woman see the Debbie, as I said, and never see I know. Won't see the Debbie, I never born once.
Doctor, where's this? What about their boots, the warranty boots and the boots for is it construction workers? Okay.
Yeah. Okay. So our construction workers and the idea no. Don't want now more point you only so much change.
That's right.
Or sa near man the city before from no fat aside for France and what to see. If I recommend the say, so we're Ghana now your construction. Let's go to me the entire day be up on all the rubber bags when a then one roll rubber bags and then Pabua for France. Said a be I won't be uncle fear and also the what. The quite be brave. So there are so many things you can do to protect yourself. So we are making this much more complicated than it is. Plastic bag, the Ghana book, into the Ukurum, the fee, will be brave, and can cry. Rubber bag, to go from the brave. Mama, the walk for rubber bag free fee. For Pablo, Gumuku, dredge, now we are. Now, after we're doing for one day, I shall rubber bag at the Chirano. Now, at least, no, wouldn't Pablo for you, then, if you could do fear, and Americans will be away, guy. We are bathroom when you see, or rent it, and that will be dying cry. Baby, I will carry a day, who could drop, or honum, the could carry roll, they carry, and son, why a day, walk all day. I will prevent, will protect the one sound.
Wow, Doctor Nyamisop, one might say. Doctor, questions at what was here, I come to 40. And we say, what precautions should I take if I am visiting an area of local or community transmission? I don't know, something I say there.
No, I don't know, kind of, that's it. And once again, there's a protocol for everything. So if I saw Washington State, Washington State has a protocol, right? Yeah. So we drew one make sure at the airport, so there'll be signs all over in terms of what you need to do. And when you go there, just follow what the protocol is telling you to do. Once again, hand washing is extremely important. Hand washing, and just making sure that. So who sneeze any idea you're covering your nose, you're covering your mouth, you're making sure you're not touching objects. Now the one say and will come with me, no one no anywhere. So those are some of the precautions. There'll be signs posted all over telling you what to do and what not to do.
Your doctor made that say, where is it? Doctor, this one, when you get okay, what is the risk of infection when you're traveling by plane since we sit next to each other?
You know what? The risk may be high, and you don't know who has coronavirus on the plane and who does not have coronavirus on the plane. And when you may start, and I think I started with saying, plane was the first thing you do. Yeah, but what they are so better Clorox wipe. I said Ziploc bag. Now, woodra where you be the paper, and it was also a table, yeah, not table, it's where we were. The seat no when you know out there, just paper, so that seat no when you prepare, no, because you may touch it, you never know. Magazines that were you want to wipe the outside of these magazines. Because if you whole crowd we do a bottle yet a show. The Pahoyana and son, I would be a day at show. So be you saw more restroom no to swap. Mr. Walk on a Clorox wipes, you know, to be so pronano and son a webway. Who go inside and make sure that you have gloves. When you're traveling by plane, make sure that you have gloves. Who go inside and so swap. Who make it also think, you know. Yes, all those piano. You're just trying to protect yourself. That's all. To protection. Who really saw one sat. Oh, who say we now walk a prono. You paper towel, you be be a prono. So there be a woman saw one in your day ankle. Who pay free bathroom without the hand sanitizer any day. I won't sound why they want nothing. Master dear, I don't know, and I can't say because once again, the CDC is telling us to say, wear a mask only if you are sick. If you are not sick, no, it's not recommended. So we share mask. But if it just so happens that if I crowd in 10 war when see war but 1 year, then it's a won't feel comfortable, dear. Then you all mask out, which media said to protect yourself. That's all I can say because the risk is high.
Yes.
But minimum for crossover to plane. So
yes,
protect yourself. Yeah.
Your doctor, that's it. Doctor, where's it? I say, doctor, thank you so much for this kind of lesson. You're doing a great job. But today, it looked like you are missing something that I've been waiting for. Which one? Okay. I say you always come out with a kind of a links like a website and things that we can learn from. This time you haven't said anything. Where can I learn more?
Okay. CDC.gov. DJ Mike. CDC. CDC.gov. G-O-V. CDC.gov. Into CDC for website. The first thing you see in the coronavirus. It can give you all the facts about coronavirus. Everything you need to know about coronavirus.
Wow. So
Center for Disease Control and Prevention. That's what CDC is.
Wow. To me, sure say when you're anti-radio, so two of them, Neko Hishim, we are when you tell my Hishim. Lesson is really what's training in our heavy. This is our bon champion, son. I won't tell you what can. Okay. Doctor, what is the risk of the infection from animals or animal products imported from affected areas? Okay. Doctor,
okay.
Question here.
Oh, but that's it. We know sir, it came from animals, right? Coronavirus, no, it's spread from animal to human beings. They say that the transmission there, person is from person to person. I cannot speak about animal products that you imported from other countries. And to protect yourself, no, so we won't feel comfortable, then do not eat those animal products. At this point in time, if you don't feel comfortable, don't eat those products. Just eat products that wouldn't even say safe. Into fruits, no vegetables, so they wouldn't even say anything if we say, right? So you can eat those products. And you can eat products also so a local. So I was a local from farms within your area, within your community. And also so you can do that. But if you stick to fruits and vegetables for now, and then more potato you will be safe. Instead. Maybe this is the time that we need to take that precaution.
Your doctor, that's a doctor. I put two preba kubi. Also, I need a odime kopa. I know a BB a bit me affected coronavirus nana.
I don't know. Minimum about some COVID me prevented coronavirus. Into one in the mecum, but and yeah, they are no prevented coronavirus. Yeah.
Wow. Doctor, another question. Wait there. I say, doctor, it look like nowadays most of the products all kind of things are coming from China and all these areas affected. What are we doing what are we doing about the packages? Okay, packages coming from China and all these places through UPS and all these places. Most of the time, you get your package in your mailbox in front of your house. What do we do to prevent it? Now, Doctor, also affected. So post office for things and Gombe, Anna.
Okay. And see, this is what I want to tell you. America, they check it. But unfortunately, so what order I am finding is corned beef. Nobody's going to open the can of corned beef, excuse me.
Dr. Tamukuchu, not choose your mommy, charm me home. Yes, sir, you better it you. Dr. Fatchame and Mama Dr. Kasa more than 2 hours. Mama no questions near sir. More about coffee boy chicken tuna uskani why late. Mama Dr. Kasa more. It will not run away channel. It's your tamukuchu. And yes, I listen, doctor, your home battery pa. Doctor. It's about to over to my answer the question. Now my you say packages are a free post office no. And then you pay your phone. Mailbox, mailman phone by around the same. No more saying no. If we are going on my twat, it's your no then you pay your phone.
The American I want to say. Chroma be a buyer check it. But products to say, maybe I will come beef and one day free baby, and I will start be a day free baby. No. And now say, and health inspect, food inspector, so move baby is a deal to at the crew. It's not going to happen. It is up to you. And it's our order aside any free outside of the country. No. Who say you were taking a risk?
That's
right. It was not made in the United States of America. So no health inspector has checked those products. Those foods, no. We order no. Obi any who are checking will come say until you are ordering at your own risk. Because you order near free Amazon, it's free all over the world, there. So I call order vitamins via free baby, free China and Southeast Asia nearby. The FDA didn't check that. Until that's a risk you were taking.
That's right.
It's a white anymore. It is a ube to me, order right in this country because I am an order outside of the country. Meaning everywhere America say. In the other day, I won't told free crowd instead of order free abonte. If you're so afraid there, then don't take that risk and just get the things right here from this country.
Wow. Doctor, once any auntie, you're careful. Doctor, where's you say? Was it okay? What is the risk of infection from contact with the pets and other animals?
Okay, those are the coronavirus no, and cross also to me carry virus no.
Yes.
So far no, right? Meaning some for more pets who from I say the more pets the vet and one more. So more annual visits. Said the woody panel. We call a doctor annually for visits no. Almost someone do call. Me check it warm. And one penny or more. I'll be was some penny and who could be a big gloomy warm. You're only a baby bring, and we work from home in our health insurance. That they also health insurance now. In one, they take care of them. So, to be nim, so who are born fear, but what the answer would do of one of the vertical. Now that I check here, making sure so you're okay. So, and son, why you? 1 year, you must want to full fee if I want one. You can ask the person, say, we update on vaccines and near Diana. So you can ask the person. We have every right. They say coronavirus. You want to ask questions, and you can ask those questions as well, just to make sure that you're safe.
Wow, Doctor, Nyamisha answer questions. Doctor, Osamiyana. Doctor Esther Free. I say, Doctor, is coughing? Let me close my mouth. Okay.
But so for your close in the mouth.
Yeah, it's Binyani here. Was it? It's coughing. Let me close my mouth.
Okay. Okay. I'm not sure what she's asking, but I think
your question, doctor.
I think said your patients or coffee on close in the mouth so who's the main and the cancer so ubawa tissue na sakata wano na bawa good tissue no uria na what tissue naturally and tissue na ntwe wo form me fa mo chow enim say you chrome Ghana de so na emagu form me fa chow and tissue na ntwe form tissue no to trash cannibal they make sure so our hand sanitizer how the be aye won sa so we are close to a bathroom so one walk on with seminar and warm water whenever you cough you sneeze so but they also have tissue now the idea who sneeze out the tissue e be kata ho ya no sneeze into the tissue coffee with the tissue be kata wano no wa cover wano said e be ya wo mo wa enwu bi fofo so and now when see enwu bi fofo.
Wow, doctor, me that's it. Doctor, I think some possible questions no. Okay, Minia Kuffour, I'll say thank you very much for your explanation. God bless you. Doctor, what I'll do is say I think any panel more now so I join it. Now questions never be on my repetition. I can want some that. It's what I'll do is say me jai Emma Hajia, okay, Hajia also your mistress so I join it. Major Amona, war up on my now let's come as soon as when you be now the airborne because I guess I may go back to more questions and Anna. Yeah, it's what I'll do is say my main friend you chum 1 second they pay brace you binom they go over kakra mine through there and now their mine and let's come as says Ghana for yeah no now boy kakra it's more time could you mama 1 second my doctor pay brace you namedi and you me at your mama na doctor abeni nyina my
to a making suno the cardia we imagine Yana Shimmy in Sajo Butia Simeni, I didn't feed the Kuroya anymore. Give a cardia chance out to Bemu in the Suwa Valley, Fidia Cassan Fidia. Yet, Samiario, don't fool anyone, I'm about Samiario, Yarisafua, Samiario, Samiaria, mean, can't you run? Yarisafua, Bago, you take us on Fidia, easy company, what you do, Samiaria, mean,
more question, Ajewa Adumaku, okay, also, Obapa Miriam, Alfie, Don, okay, I say what is the dear sentence? Doctor, Ebe Canning, I tell them got some major questions, no, concern never need dorsal. Now, my doctor, and go over, said a beer, you been yanning, I may show some more bets, you know, and I'm questions now more. It's doctor, major platform now, now, what do you go through? And then you don't want to cry. Fire lady, woman, I see my neck go over my quick, Midasi.
Okay, my friend. All right. Into coronavirus, a virus to be a cause of respiratory illness. It has a respiratory illness, a area affects the upper respiratory. If we lungs, no. Your honeymoon, assuming you are a whole end, your friends, the coronavirus, they are affected. Or coronavirus first, Wuhan, China. Or virus, no, a zombie, and no tongue, and why won't you? Any your friend is saying, animal market, and what in general. Na coronavirus no a time e wo mo amu nti e wo camels mu e san so wo cattle e san wo okra cats mu e na bats nso so e na mo ahodo bebree em sen ko so bo sa aboa de di e ma me e wo line so coronavirus e ba ye na spread every out e mo e ko nipa mu sa brain the coronavirus is spread from person to person. Now global cases of coronavirus there over 109,000 cases in the year. Over 3,800, nipa 3,800, and I day every coronavirus no more. Yeka ho asem. Sabre coronavirus he fan e wo Africa. Africa baby omo hu South Africa, omo hu Nigeria, omo hu Togo. And omo say hu so Algeria and so. America has say so aye day e wo ha pa. E bi so Eastern Mediterranean and so e wo hono. E sa wo Europe so. Omo hu so Southeast Asia. And so and Western Pacific is also coronavirus e wo hono. E kwai be the first coronavirus is spread there. It spread from nipa to nipa. Kane no e wo mo amu ntike free abo amu na be nipa. Saa brain for when you're also spread it from person to person. It is all about within 6 feet of obia close contact. Let's say if I call coronavirus, no when see so maybe I went see the BA day, echo hunimu and not what about when you and also between or transfer virus na day, abra wuni pass, droplets. And what are very contagious with coronavirus when you're very contagious time or diarrhea pa. Si brand if I call the diarrhea pa no. I would think that's what yari and the temperature cost one near the Sabin and if I call yari for which near spread the yari and a day. Aqua will be a day, F4. Sabri almost say if you have surfaces, you have navia infected. In the final cell with surfaces, navia or kitchen or countertop. Hospitals or more tops with countertops to bria, abia computers, yet the ACC, modern near MSC, when they are needing average infected. Into almost some places need average infected. So what now our rules are maybe I'll go for tattoo now when ya ube to me a day. Enya virus na a day, every honor. Sabre virus no, it is spread from person to person. Sabre near who's a community spread and so I day or community transmission. The air for pa and canka Washington State. America has said your who's our community spread and virus spread with various communities. Then that's nursing home now. Or who Washington State now virus na a day. Spread the a day. There were imported cases of coronavirus and so Hong Kong for about I travel outside of the continental US or the coronavirus here day. Abba crude game. Yedim for normal cruise ship no more. Even though the coronavirus naba hase. In California, Sabri and himself cruise ship be or Horman Kofoni be any coronavirus. Or the Abaya day about the state of California. Yeka Sabri. Our ship no. Or why I say mobile quarantine for one or 4 different military bases. Say back or Georgia, or Texas. And then say back also California. On the quarantine for 14 days. No, I check your temperature. I make sure. So I check you more regularly. I make sure so wouldn't be. So why wouldn't it be? You know, after the 14 days, they be annual. Even walk with you. Also, I will be no so. Like I said, was a Sabri near local hospital near about supportive care. They can't want them. You see, America had them. There are about 512 cases of coronavirus. Now, that information where I got it just before I made my program. It could have changed as we're speaking. But just hold me to 512 that may catch on because that's what I have now. Meaning, say, Brasabrino, ABA assistant, before shipping the crazy and you need ABA cases, the prayer was on. And cases of America, as they say, I increase here. And here, Washington State, I over 122. Nipa 14 at 18, and there was state of Washington from coronavirus. New York, Nipa 106, and California, Nipa 104, Baku, Massachusetts, Nipa 28, Ubiye. Texas, Nipa 22, Ubiye. Nebraska, Nipa 14, Ubiye. Oregon, Nipa 13, Ubiye. Florida, Nipa 12, Nienu. Colorado, 8, Illinois, 7, Ubiye. Yako, Georgia, Nipa 7, Ubiye. New Jersey, 6, Arizona, 5, New Hampshire, 4, Pennsylvania, 4, Rhode Island, 3, Tennessee, 3, Maryland, 3, Nevada, 3, Utah, 2. Obianya free state yami bo mudin yinara. Yeshe North Carolina, Ekopim, Kansas, North Carolina, 2, Indiana, 2, South Carolina, Virginia, Wisconsin, Omunyano, Nipenya wohono, Obianya wohono. Yeshe Washington, D.C., Nipa 1, Missouri, 1, Vermont, 1, Connecticut, 1. Testing. A quite bad thing tested for coronavirus. CDC for our kits no almost send it to various labs that were United States. You bet me a test here. On bet me a swab of Hunimu Honomo and Minimu near they are send Diaco. I say you bet me a boab or one what in the will contain a minute to the heading. You send any papa for testing. And the symptoms there I walk coronavirus will be any day, any a what. Say I want to be home. Ubenya fever the bear 100.4 degrees Fahrenheit and now 38 degrees Celsius. Now when your pain will check. If you have why you're confused, one no ebe to me are blue when you see a day, ebe to me are blue. Prevention. Quite best now first to prevent the coronavirus. Oba avoid the close contact with Obia or Yede or Yari. But what they are now avoided that so be to me. So won't to me so where Juma especially in the healthcare facility. Follow protocol now one healthcare facility. So almost say gloves, almost say mask, almost say gown. But what they also follow protocol and what cut them say mask into me. It is to protect you. Facility, no imagine didn't say so more cultural, so this is what you need to do. Follow what the protocol says. That means to avoid so by touching when anyone win it. So obey to me and if you touch those places, but what they are no they pay for one and also be to me abwa. We are stay home. When him say yeah, you free gun and the African could be so no. Yeah, cry. Near quay, you know, what most and then need what you do be a and so where you ma. This is the time our area sitting here. So what next year? That's where you so be you with dear. Walk up a lawyer. Now the local court. If we say they say I do a walk in and see internet area. But I was so area and what nephew. Shana ABL will be appointment. You see me what nephew. If you could you a different you want so anti Vera crack as an internet in the only if you're sick. In Kuchan trust away yare. Then found run no errand. Why didn't you so and no son, Ubaya who be there. So when the 6 days are and Conquer yes, I didn't go for near my name day emerald. So won't bow up. And now when see use tissue. Use the tissue new ya no watching it. Wow, that the bathroom may what. But what they are so better carry hand sanitizer with you at all times. Now the be own sack. Now they are own saying for so in your bathroom or between for home sounds a day. And will honor. But what they also be cleaning what disinfected all surfaces, all objects. Into we'll see our kitchen counters in Clorox wipes, you would be paconomo, or bathroom, or clinically, what we say paconomo, our doorknobs, the won't see, a puna won't see, who soma will be in the knobs, no, making sure that need other paper home, any idea, or toilet seats, or paper home in our clean, making sure that now you clean surfaces, a form, I will kitchen form. You're making sure that you are cleaning your house, you are disinfecting your house. Said you be crowd obey to me your phone. Say so much I say we here see a face mask. So when you react, CDC see a we here so a face mask. So when you are ready, then yeah, so a face mask. But so when you react, and we here. Hand washing. Oh, that's why making sure that you're warm. You're hot too, warm. Now it is seminar a day you have to wash your hands for 20 seconds. How do you know say 20 seconds? Oh, to happy birthday cookie. That is 20 seconds. Which we are over saying any idea. Into me a moment they see a base hand washing. Coronavirus, you need who drew, you need antiviral I recommend it for coronavirus. You need vaccine for coronavirus. Your vaccine for influenza. You need vaccine for coronavirus. Your antiviral in for influenza, you need antiviral for coronavirus. So I bring pharmaceutical companies, they bring research to come up with a vaccine and have to come up with medications. But alone, it's going to take a little bit of time. It's not going to just happen overnight. In Kuffour, it takes time because there will be a checky vaccine to make sure it's efficacious, meaning it's a year, Juma and Sana, the public. So clinical trials, the idea has to okay. It still has to go through the FDA for approval. The idea it's within the next month, and you bring your home vaccine and they drew. It may take some time. And sana, to me, any so feels why you're exposed to coronavirus. But what the other friend doctor office, next catcher woman say, who feels so why you're exposed to coronavirus and sana what's sorry alcohol because the doctor may tell you what to do. Say be as a mask and sana waba. Do this before you come. If you're a doctor office and sign away the way to sign a more day alcohol, it will put you home at higher risk of actually getting the virus. It be any older adults and go for when you need penny. One can't tell more would say long-term care facilities, nursing homes and our group homes and the idea, or more heart disease, diabetes, any lung disease, or when you are at higher risk of getting the coronavirus. Once again, we name about any home remedies for coronavirus. In say Kuffour about garlic, and Kuffour about alcohol, and this animal so no alcohol, a bit to me a bois, would you make a bebois, would you garlic, and no dear minimum was them. I don't know about any home remedies for coronavirus. There is no research that is backing that up. Into the ceremony, see your chrome dear. We bet me a couch, so we reside here with a bebois. Oh, you are really in to be true. My technocracy as your so could be safe. When your coronavirus grew, a odi agu bottle mu asa abre wo ton ne dindin e wo yukuro hono mo minim obofo a wonya coronavirus e wo heaven saa osofu yi ekwaje saa eduro ni free heaven odi abregen enye no kore mo me enye saa ne ma ni let's just take precaution to say the bruni na ka kire no ye hohoro ye nsa ye avoid nkofo mo yare ye yare so aye ntinesie we are adwuma healthcare facility a wo kwa protocol e wo kwa ya ka cho to follow that protocol no clean wo fie clean wo surfaces and ade wo grocery store cart na wo no body aso be use omo wo hand sanitizer wo I hear friend say wipes wo no e wo grocery store bia wo fa bi na wo de apepa ho nyina nsa no waso my day e pushia ye day akọ no akọ wo niema e wo so wo to madam wasi bebree I hope that wo mo ba late no be questions I answered DJ.
Yo, doctor, you better sipa MC ene one my ensampa etiapo adofo more na do answer nyame insha doctor osimamo please do wants to how about this virus even after treatment and then exposure. Wow, I'm say ene nyame adom doctor ya twene mu ye hajia rookie wasi erade no the virus ne picture be de ho aba it just say ehu chere ni ehu no ni ehu ni say anodin saba and the doctor three mama you say ade no anodin doctor em say ma twu mu ye more than 2 hours nyame shop and line so ye she eni pa eguso no nyame shop mo ni say yare no ehu nti o si yesua ho ade eti doctor bomodin na pa more research na ya odi abre na sere na amanfo atamu kuchu no me won kra nyame nhira mu nyina se mo baso me kase me bomu din a mentimi ni nyina eti sere doctor ayamaye no ene waye ni nyina mesre se unya bra ko back uko YouTube Facebook your website babia social media na de ya to apete wo nya abotre ne ko botie obehu de wa chechirem ni nyina ebi wo krobo ani enim entade ni we nyina ni enim ze ni nyina ka ho doctor message say ba say God bless you
amen
nyame inshallah omo hodin na de bia be ma a free consultation ba me meje no back door ti mo de mo fa cash no emra amen doctor doctor nyame inshallah ti adofo Hope for Life Radio no wasuguso awutie no and then you and your health jumedie no yanka say doctor Vera Kuffour Manu and Yetenika or the Jumedie no abre. It is a new no antienka na you and your health Jumedie and ne hane yedimobisi. Pictures na edito so earlier no me bonyomo be the beguso now so when you be ashe. Yamisha so nya kwan ebekan ye ho.
Rio, don't fui, memo ya ri kumio. Samia Rio, ya risapo. Samia Rio, atumanguma. Samia Rio, me kokanchurama. Ya risapo ba kupeneria siwo. Samia Rio, don't fui, memo ya ri kumio. Samia Rio, ya risapo. Samia Rio, atumanguma. Samia Rio, me kokanchurama. Ya risapo ba kupeneria siwo. Utumiko bampo na yedea Oyawada kakisua utumikoma Wafo komba batuda Matiti ya finisi ya mrehumo Jarida wadi ya fumina mwe Ate mfiti ya riremini petu ya imua Afedi ya yasini da swaso Nia edia enya yiyi Mabere megu Etuwa mejungina Wekuwa shamisuano Mekadia we majugua Yana shemi jiti Inim sa jubuti asimeni Yadim fidikuro ya rusheni mua Kieba kadia chansa chirano Ube muwa nina suwa mbayo Fidie kasan fidie yedi Yeti sami ya rio Don't fuwa wanimu wana mabaya Sami ya rio ya rezafuwa Sami ya rio Samia me kokanchurama ya safu ba kupeneria siwo Jideka sam fidie yedin Nisi kampani wajidio Samia Maria May, Okanchurama, Yarisafu, Bakupaneri as you walk. Every year, you bet to me be a basic as a sea, a Cassia. Anyone to your Trinity, I have a and so I are set to him, young couple. Only more years and the better have a permanent to my area. And you never knew a semi career. She am on things who attack us, such you, I mean, Samario,